As we go into a very important time in Arkansas with issue 1 on the ballot, with so many decisions that our Highway Commission has to make daily. And I want to applaud our Highway Commissioners that are here, which I think we have a full contingency of. Mr. Chairman, would you introduce the Commissioners? And we have our new executive, and we have our new director.
And our new director to be Lori Tudor. She'll take over director on March 20th. Scott Bennett, who does not like to be overlooked, is still.
Oh. Scott, I just about overlooked you. That's right. Yeah, thank you, Scott, for your leadership. And I also wanted to, before I make the announcement, say a word about Tom Schick, and grateful for his longtime leadership, service on the commission, and service to the state of Arkansas. And I understand Patrick is here. And Patrick, thank you.
Good afternoon. I'm Dawn Scott in the THV 11 studios, and we are breaking into our regularly scheduled program as we await this press conference with Arkansas Governor Asa Hutchinson. He is making a few quick announcements right now, some housekeeping, as we await an update from him on the coronavirus. Some latest information: there is a second presumptive positive test here in Central Arkansas. An Arkansas Children's Hospital worker tested presumptively positive for COVID-19. Also, Little Rock School District, the largest school district in the state, just announced that as of tomorrow, it would close schools at least through spring break. That announcement came just moments ago from Little Rock School District Superintendent Michael Poore. We're going to listen in for a moment now from Governor Hutchinson as he updates the public on COVID-19. As you know, yesterday he declared a public health emergency in the state of Arkansas. Let's listen in.
And she brings the perspective of someone that is dedicated to public service. She's from Central Arkansas, she's from Little Rock, and it's important that our next commissioner is from Central Arkansas to bring balance to the commission. And I cannot think of anybody that will serve the commission in our state of Arkansas better than Marie Holder, and I know she'll introduce her family that's here as well. But if you would, please join and welcome the next Highway Commissioner for the state of Arkansas, Marie Holder.
I am honored to serve the people of Arkansas and Governor Asa Hutchinson. As a mother of 2 children, Alex and Kate, one of whom is a newly licensed driver, Alex back there, she's 16 years old, I will put safety first in every decision that I make. My commitment to safety begins with encouraging voters to go to the polls on November 3rd and vote yes on issue 1. This continuation of highway funding will ensure that we can provide critical maintenance and improvement to Arkansas state highway system. As a businesswoman, I will work to promote transportation system's fiscal responsibility and transparency. It is a great honor to fulfill the term of Tom Schick. Chairman Schick was an excellent advocate for the people of Arkansas and the 2nd District. It is a great honor to fulfill the term, it is a great honor to serve with Commissioners Farmer, Gibson, and Chairman Moore. Also with Philip Talbot.
As the governor there takes care of some housekeeping related to the Highway Commission, we are going to give you an update on the coronavirus in the state of Arkansas. There are now 2 presumptive positive test results here in the state of Arkansas. This has prompted school closings across the state, including in the largest school district, Little Rock School District. As of tomorrow, school will be closed there through spring break. Several of the colleges here in the state of Arkansas have decided to hold virtual classes until March 30th. We also know that the first case yesterday was in Jefferson County in Pine Bluff, and that patient is in quarantine at Jefferson Regional Medical Center. We also know that the second presumptively positive test came from an Arkansas Children's Hospital worker. That worker is also in quarantine. And we know that people right now, the health department is looking for people who have been potentially in contact with any of these, the worker at Children's Hospital and also the patient in Pine Bluff. What we know about COVID-19, of course, it started last year originated in Wuhan, China, and we know that as it's made its way across the globe and now here to Arkansas, as I want to listen in just to see if he's saying anything right now. He's not, according to our producer. Okay, thank you so much. So what we know about COVID-19, it is a novel virus. So what that means, a lot of people are comparing it to the seasonal flu or influenza. Here's the difference. The flu is known by health professionals. Most all of us have some form of immunity to the flu. We have a defense against it. We have a flu vaccine, and we also have measures to take if someone is diagnosed with the flu. We have Tamiflu and other medications that they know we can use. By saying that COVID-19 is novel, it means it's new. It's never been around us before, so we have no immunity to it. We have no defense to it. There's no vaccine, and health officials aren't quite sure how this is going to play out. Some people are reporting that they have very, very mild symptoms. They may not even know that they have this, whereas other people, symptoms are very severe. And that is their concern. They want to protect the people who are at greatest risk, who are elderly people, people with chronic illnesses or disease states. That is their concern, that someone could potentially have it, spread it unknowingly, and then someone becomes severely ill as a result of this. So that is why the CDC, the World Health Organization, the government, as you hear from Governor Hutchinson and all officials, the mayor of Little Rock, for example, what they're working to do is to change the outcome of this virus. So what they're asking is people to socially distance themselves. That's why the schools are closing. That's why people are being placed in quarantine. That's why large events are being canceled, or people are being advised not to travel, so that they can potentially stop the spread of this while we're in this state where we have no immunity to this virus. So all of this said is not meant to create a sense of panic or fear, but more or less vigilance. Vigilance with how you conduct yourself, how you conduct your family, how you conduct your business, where you go, what you do. All of those things can impact the outcome or result of what this ends up looking like on the other side, which is why we're here on air with you as well right now. It is concerning, of course, as once again we know Little Rock School District's closed, Bauxite School District, Bryant, Benton, Pine Bluff, and so many more are coming into our newsroom. What we're hearing is that the governor is going to announce that all schools close. That has not yet been confirmed, so I want to be clear, that's not yet been confirmed, but that is what some of our journalists and some of our reporters have been told. So that's what we're awaiting. We're awaiting to hear from our governor, Asa Hutchinson, on COVID-19. So once again, just to recap, if you're just joining us, there's been a second presumptive positive test result in the state for COVID-19, and this person is a worker at Arkansas Children's Hospital. And right now, the Arkansas Department of Health and state health officials are working to determine who this person came into contact with. They want to reach those people and ask for self-quarantine among people who potentially knew or were around this person in the second case. And there's also the first case from yesterday, the person who is at Jefferson Regional Medical Center there in Pine Bluff. We have a team of journalists covering this for you. Again, our mission is to bring facts and not fear. And one of them, THV11's Rolly Hoyt, is at that governor's press conference that is expected to begin at 1:45. Clearly, he took care of some business there, and we want to hear from Rolly now from what he is seeing there in the governor's conference room.
Yeah, Dawn, we are expecting this meeting to reconvene in just a moment after the announcement of the new highway commissioner that had been planned earlier in this week. We are expecting the governor to address several important things, verify a second presumptive case, to someone on the staff at Arkansas Children's Hospital. Also expect him to address the several school cancellations and closings or postponements that have now been announced by several large districts in the state. There's going to be needs to address care for students and families as we go through these couple of weeks ahead of spring break, and then generally an update on the spread of the virus within Arkansas and how the healthcare system is preparing for what they think will be an influx of patients. So that's what we're expecting to hear. There has been a sense of inevitability, as we've seen over the last few weeks here in Arkansas, that this day was coming. About 2 weeks ago, the governor started to convene everybody in his cabinet to make sure they had plans in place. And so we're going to see now how well those plans are doing plus 2 days into our first presumptive case in the state. So that's what we'll be listening for. Again, as you mentioned, Don, we're going to be trying to sift through getting the facts and less things about the things that are scaring people. So, we've seen several politicians going out there and doing their best, both on the national level, to try and get their side out there, the things that they're focused on, the urgent needs that they see on a national scale. We'll be listening for what the governor might be able to say for plans here in the state. Again, to try and keep calm, keep people from panicking, but also keeping them prepared for what's coming up ahead of us.
Again, THV 11's Rolly Hoyt there in the governor's conference room as we await a 1:45 was the scheduled start time for this press conference with Arkansas Governor Asa Hutchinson. Yesterday, just to update, the governor declared a public health emergency in the state of Arkansas. He ordered that all state employees on professional business ban travel for a 60-day period without permission. It's just an effort to keep people home here in the state of Arkansas. The state health department confirmed the first case of COVID-19 in Pine Bluff, and then a second one today. A worker at Arkansas Children's Hospital tested presumptively positive. And when we say presumptive, that's not to mean that we're questioning the test result in any way, shape, or form. It's a positive test for COVID-19. But because this virus is so new, the CDC also wants to back up, confirm, if you will, the test results. So those test results are being sent to the CDC, and in which case then they'll be confirmed. There's no reason the health department said that to believe that these test results would be false positive. They believe them to be positive, and they're acting accordingly. Again, we're awaiting a press conference from Governor Asa Hutchinson, an update on COVID-19. Also, if you're just joining us, the largest school district in the state, Little Rock School District, just canceled school beginning tomorrow through spring break. So now we have an added issue of what to do with the children, child care issues potentially, and I'm told that the governor is now approaching the podium there in his conference room, joined by health officials there. I see Dr. Nate Smith, the state health officer, along with I see a military presence as well. We'll listen in now.
Today I'm joined by Secretary Nate Smith, of course, our Director of the Department of Health, but also Marcy Doderer of Arkansas Children's Hospital, Dr. Cam Patterson, UAMS. I'm also pleased to be joined by the co-chairs of the Senate House Public Health Committee, Senator Missy Irvin and Representative Jack Lademan. And I want to thank them for their support of what we're trying to do here in the state of Arkansas. And Mayor, I also want to recognize the Mayor of Little Rock and thank you for your partnership. I know you've had to make some tough calls, and I wanted to recognize you and your partnership as well. The purpose of this, and I talked to Dr. Smith today, that as this continues, we're likely to have regular updates to you. And it's one way to flow information. Today is, I think, important to communicate once again to the public. And I want everybody to understand that as we make decisions, I want to be guided by the recommendations and counsel of our public health professionals. And that's why our public health experts are here. This is a public health emergency that I've declared in the state of Arkansas, and it has to be dealt with in a public health fashion. And so I want everybody to know that we're listening to them and making decisions. Secondly, we're trying to give information to the public so that they can make the best decisions on their lives and their family and their plans. And so we want to share information as we have information as well. In terms of an update from yesterday, and the last 48 hours has been a whirlwind, because we had yesterday announced the first presumptive positive test. Well, overnight I was advised that we have 5 additional presumptive positives. So a total of 6 presumptive positives now, which does not come as a surprise because we've seen this in other states, that once you start testing, once you have an awareness as to the impact in one area, you obviously do additional testing and tracing and sourcing, and you learn of others that would have been exposed to it, and you're naturally going to have some additional positive tests. And so it's not a surprise, but it also is a signal that we have to take additional steps and action. Now, I look at it geographically, because something happens in one area of the state does not mean that another area of the state is automatically impacted. And so that is a factor geographically. We also have to recognize that we have a lot of meetings in Arkansas, and that people from all over the state or elsewhere travel. And so even though it might not be impacting your area, are you having contact with people that are in a different area? And so you have to take precautions that our health professionals will be talking about. In terms of action items, whenever you look at the additional presumptive positive cases, they are in a 4-county area: Saline County, Jefferson County, Pulaski County, and Grant County. When I say they're in those counties, it could be the patient, it could be a family member, it could be where they go to school, but there's some contact with those 4 counties. And because of that, we're having to do a great deal of tracing and running it down, and additional tests and interviews, and telling people, you know, that you've been in contact with somebody who has tested presumptive positive. And so those are the steps that we're following. But while we're doing that, of course, we get a lot of calls from the schools. And out of an abundance of caution, we have advised, and this is in consultation with Secretary Smith and our Commissioner of Education, Secretary Key, that we go ahead and advise that the schools in those 4 county areas should be closed for the next 2 weeks. And that allows us a time to get a handle on this. It allows us to do the checking that is necessary, but it is an abundance of caution for those children that would be going to those schools that might have some distant connection with an exposed individual there in that area. We are continuing to work. General Penn is here. We've got our Adam that is here as well. And we're working at looking at our stockpile, what is available in terms of protective equipment. We have an order in for additional protective equipment. So we're working those items to make sure that is available to our professionals, to our responders, our healthcare workers, and we're continuing to look at that and look to beef up that stockpile. And so with that, I wanted to recognize Dr. Smith to make additional comments, and then if we could go to Dr. Patterson, and then to Marcy Doderer as well for additional comments. Dr. Smith.
Thank you, Governor. I want to thank the Governor and his team, as well as the other state agencies, for the support they've given in addressing the COVID-19 issue here in Arkansas. As the Governor stated, overnight we have identified 5 additional individuals who have tested positive, and we will continue to do contact investigations for their contacts as well. So it's a widening circle of individuals that we're identifying, having them quarantined, and then testing them if they become symptomatic. Because some of these contacts were school-age children, this move was made in partnership with the Department of Education to recommend that those schools temporarily close to interrupt any cycles of transmission that might occur. We also are continuing to work to find additional information. We'll extend guidance to other communities if we find that there's need. We're working very closely with UAMS and with Children's Hospital in identifying contacts for this cluster, and we'll continue to work with them to build our capacity to address the needs of those who have potentially been exposed or those infected with COVID-19. And thank you.
Good afternoon. I want to thank Governor Hutchinson and our legislators for helping us to marshal the resources that we need to stay in front of the COVID-19 infection that has afflicted several Arkansans. And we are fortunate to be able to work closely with our partners, including Arkansas Children's Hospital, to make sure that every Arkansan, regardless of your age and regardless of where you live, is being adequately protected. At UAMS, we remain a resource for patients who are in need if they have become infected, although it is important to emphasize that our number one goal is to keep patients where they are if they are infected and if they are at a site where they can receive care. Because most of the care that is rendered to a patient with COVID-19, in fact, all the care that's rendered for a patient with COVID-19 is exactly the same as the care that we would give to a patient with a severe influenza infection. So that's important to emphasize. It's also important to emphasize that we do not have limitless resources, but for the time being, we have adequate supplies of personal protective equipment, medications, ventilators, and other medical necessities that would be needed to adequately take care of even a substantially larger burden of Arkansans infected with COVID-19. Now, as we move forward, we're going to have to keep close eye on the supplies that we have, and we're in communication with our partners, not just locally like Arkansas Children's, but our partners across the state to make sure that resources are available where they are needed. It's also really critical that we get the message out that if an individual is concerned about the possibility of having COVID-19 infection or they have questions about this, the last two places that they probably want to be are in an emergency room or a crowded clinic. And so this is a great opportunity to utilize other tools to get healthcare information. We are pushing as much of this out as we can. If we have hospitals, communities, clinics, or individuals that need more information, we, along with ADH, along with Children's, will be sources of that information. So do not hesitate to point people to us. If you come to UAMS and you have symptoms that might be consistent with COVID-19 infection, we have set up a separate triage center on our campus so that we're not mingling people who might have COVID-19 infection with people who have other medical issues. And UAMS Health Now is available to all 3 million Arkansans who have questions or concerns about COVID-19. If you go to UAMS Health Now on your iPhone, your tablet, your laptop, you will have the chance to interact visually, face-to-face, with a UAMS healthcare provider 24 hours a day, 7 days a week for any question that you have or concern that you have for free. So please get the message out. If in your community there are clinics, hospitals, individuals who have concerns that we can address, we are here standing by to help you out. Thank you.
So good afternoon. The one thing I might add to that is how to access some additional information specifically for children. Like my colleagues, I am extremely grateful to the help of our elected officials and particularly the Department of Health on how we're dealing with this, and you should be assured that you are surrounded by some really amazing and talented healthcare providers at all of our institutions right here. To augment and support the UAMS Health Now telehealth app, Children's Hospital, as of right now, has a 1-800 number available to any family who has a question about a child health issue related to COVID-19. 1-800-743-3616. That information will be pushed out publicly here very shortly. It's a telephonic way of answering those questions, but it will keep our children at home where they need to be and not necessarily in overcrowded clinics or in our emergency departments. Like others around the country who have faced this, we are implementing travel restrictions for our staff, visitor screening, staff screening. Really, it's an elevated way of responding to COVID-19 like we do regularly in the influenza season. So we have those precautions in place every winter when the flu hits us. We are just keeping those in place as we move into spring and being very, very precautionary on how people walk the hallways of the Children's Hospital in order to protect our staff and our teams and our patients and visitors as well.
Let me just add before I turn it over to questions that in terms of testing, we have the testing capacity through the Department of Health, and as this continues to change day by day, we are looking ahead and saying we need to have greater testing capacity. So we're working to expand that. UAMS is partnering with us on that, and thank you, Dr. Patterson, for looking for procuring the necessary equipment to do the testing at that site as well. So we'll be working in partnership with them to increase the testing capability within Arkansas. With that, I'll be happy to take questions.
These are presumptive cases, so how quickly can you get them confirmed or prove that they're not confirmed cases?
So presumptive, of course, is that they're confirmed by our Department of Health testing. It is at CDC, and I think the answer yesterday was we don't want to put them in a bind for a response, Dr. Smith. But have we received any back yet?
No, we haven't. Of course, as you imagine, CDC is confirming tests for all the states. Our protocol is that for the first 5 positives, we'll have those confirmed by CDC. We're very confident in our results, and we're acting on them as if they're confirmed positives, but we won't call them confirmed until we have our first 5 positives confirmed by the CDC lab.
Are these 5 cases overnight related, and were they folks who had previously been in quarantine, or is this community spread?
I'll start with the last one. This is not community spread at this time. These are contacts to cases, and then we're going to also be assessing contacts to those cases. We don't have evidence of community transmission that is out there that we don't know about. For these new presumptive positive cases, were contacts with the patient that we talked about yesterday. One is separate, and then we're also and then that was acquired from contact out of state. So, but unfortunately, none of these were individuals who had been in quarantine prior to turning positive.
What's their condition? What's their condition right now? How are they feeling? What are the symptoms and the
All of these are outpatients. None of them are admitted to the hospital.
Will school closings be the protocol as more counties get touched by this?
The school closings will be taken on a case-by-case basis. I think it's important that whenever we have activity in one area of the state, that we address it as we have here, but it doesn't mean that a school district in northern Arkansas has any issue and any concern, and they shouldn't close. And so it's very, very important that parents and schools not overreact to what we are doing today. We're basing it upon the data that we have. This recommendation is based upon my conversations with public health professionals, and that is in the limited 4-county areas that I mentioned. As we have additional concerns or requests, we will address those, but this should not presume that there'll be others closed down the road.
Children's Hospital is confirmed apparently that one of the suspected cases, presumed, is an employee there.
I'm sorry, I didn't.
Children's Hospital. Marcy,
The
go ahead.
confirmation that is an
It's a
Arkansas Children's employee.
Yes, so It's a
Step with the microphone, please.
yeah. So it's a UAMS trainee who was practicing at multiple hospitals in Arkansas, including Arkansas Children's Hospital, as part of our partnership with Arkansas Children's.
So how long have they been, I mean, have they only been at Children's, or have they been in multiple hospitals?
So there's some information about the case that I can't share with you, but the individual was sick for a couple of days.
And so that makes me wonder about specifics on all these cases. Are you gonna, I mean, you're saying we have counties, but do we know where the people are from or any more about them, about their condition, about,
Yep.
any other specifics?
Certainly. Our criteria for recommending that a particular school close will be if there was a child who had a contact and could be potentially communicable, because we want to interrupt cycles of transmission before they occur. Now, in this outbreak investigation, so far we've identified school-aged children in a number of counties, but the decision was made to go ahead and recommend those closures for the entire county, just to give us some buffer of safety on that. Now, if we identify contacts that are in schools outside of those county areas, we'll make recommendations to those schools specifically. In fact, we will be issuing guidance later today to those schools, giving them a number where we can consult with them so that we can make informed decisions on school closures in a coordinated fashion.
Well, specificity, I was wondering about, was about the patients themselves. I mean, are they find people, where are they from, where are they now?
We won't give specific information about those individuals, like their address or things that will identify them.
No, I don't want
Right. But
would, I'm just wondering.
4 of these were contacts. Right. 4 of these were contacts with the patient in Pine Bluff, and one of them was, was not, but was, subsequently placed into quarantine, and those contacts are also being followed up.
Does that include patients? I mean, if this was an employee or a student, employee, however you guys.
For the trainee, yes, we're looking at all potential patient contacts.
What are you doing to ensure that there's one clear message getting out to people? If someone calls the Department of Health and calls the UAMS hotline with questions and they're told 2 different things, what should they do?
Well, I trust they won't be told 2 different things. We're doing all that we can to have a coordinated message, but the Department of Health has the lead, and so in terms of our state agencies, that's part of the purpose that we're all here together today, to make sure that our message is clear, it is united as we talk to the Arkansas folks. And did you want to add to that?
Yeah, I would just say that we're all in almost constant contact, everybody who is up here. So there's really no separation in terms of what we are articulating and what ADH is articulating and what Arkansas Children's Hospital.
Some technical difficulties there, but we will rejoin just as soon as we are able to fix that problem. But to recap, in Arkansas right now, there are 6 presumptively positive cases of COVID-19. The State Health Secretary there, Dr. Nate Smith, just said they have no reason to believe that these are false positives. They are treating them as though they are positive cases, as is standard right now for cases involving COVID-19. The test results are being sent to the CDC for confirmation. They have no reason to believe that they won't come back 100% positive. 4 of the 6 cases that they just confirmed, those patients had contact with the initial patient in Pine Bluff, so they were called contact patients. That means they had contact with that initial patient that we learned of yesterday. And the sixth case rather was believed to have been a person who had traveled out of the state of Arkansas. So once again, if you're just joining us, 6 now presumptive cases of coronavirus in the state of Arkansas. These cases have been identified in Pulaski County, Saline County, also Grant County, and Jefferson County. So in those 4 counties, those patients have had contact with children. So the governor ordered all schools in those counties to close at least through spring break, and this is beginning tomorrow. So schools in Jefferson, Saline, Pulaski, and Grant counties are closed through spring break. According to Dr. Nate Smith, the state health officer, we want to interrupt transmission before it occurs. Also, none of the individuals had been in quarantine before testing positive. That's why they're concerned. We have our shot back up with the governor in his conference room. Let's listen in.
You know, we've had some innovative employers that have already made very generous leave available for those that might have to take care of children or that might have to be home quarantined. We're looking at the issues of the food as to whether there's any alternatives there. In terms of the testing, and I should have had Secretary Key here, but I think he has a state board meeting today. But the schools that they're really going under the AMI protocol, which allows them to continue education even while the physical school is closed during this time. And so we hope education will continue. They have and these are schools in Central Arkansas that should have availability of the internet and the capability to continue that education stream.
Congress and the White House are making stimulus packages for companies and workers. Are there things you think must be in a final package? And if it comes to it, what could the state do to shore up the local economy?
Well, it could be a growing list. You know, if you had asked me that question 3 days ago, it would have been a short list. Today it's a longer list. 4 days from now, we'll see where it is. Congress clearly is receptive, and again, I want to compliment the General Assembly. They're receptive as well. I have no doubt that we could call a special session of the legislature if need be, and that they would put forth whatever was needed to address this problem. Resources are not the issue in terms of financial resources and money to do the procurements to make sure we meet the needs out there. Now, the availability of the assets that we need are an issue, and that's where we want the greatest help from the federal government is to continue to expand the testing capability and help us on that to continue to be able to make sure that we have the manufacturing capacity on the protective equipment that's needed. Those are the helps that we look at first, but I do expect a supplemental, and Dr. Smith and the team will be submitting information to make sure that we have what we need.
Governor, what about large gatherings? We saw Governor Brown over in Oregon say no gathering over 250 people. We have the legislative session coming up. We've got a share concert just not very far away. There's a lot of big gatherings. We saw Little Rock do its part in the city, but what about on a larger scale?
Going to the basketball tournaments?
I'll have a conversation a little bit later about the basketball tournament. But in terms of the gatherings, you know, this is where, you know, the private sector makes decisions. There's going to be events that are canceled because they make the decision in consultation with their health experts that it's a good judgment. In terms of our recommendations, I'm going to let, you know, our professionals address this more specifically, but our businesses, our organizers are making good judgments. I know that there were some big events in Little Rock tonight that are canceled. Whenever you look statewide, it's not right for us to mandate statewide that an event in Jonesboro is going to be canceled. And so I have to look at it from a statewide perspective, and the mayor here looks at it for the city of Little Rock and made some judgments today that I fully support, but that's not ready to be mandated statewide. And so we are looking at this very carefully. Now, in terms of of just simple advice to event organizers, I'm going to let our professionals talk to that issue.
Well, I would say first and foremost, the key steps in mitigating continued transmission are the simple things that we talk about: good hand hygiene, being alert to symptoms. Those are hand sanitizers. Those are the tools that have been proven to be helpful. For social gatherings, those same rules apply and remain important. Mayor Scott, I think, has made the right call about events for the city of Little Rock, and I think we need to give everybody the right information that they can utilize to make the right decisions. If you've got a gathering of 1,000 people that are coming from all over the United States, and you don't know where they're coming from, that's probably an event that you don't want to have happen right now, and that's good common sense. If you've got a smaller gathering with a small group of people in an area that doesn't have any active cases, I think it's very reasonable to say that it's the right thing to do to allow that event to go forward.
So what about the capital?
Governor, what is the current testing capacity, and what do you guys think you need it to be? What are you asking the federal government for more resources to get it to?
Dr. Smith, I'll let you address that first.
The testing capacity has really grown a lot in the last week with commercial labs coming on board. And so if a patient has a specimen that's sent to LabCorp, Quest, or one of the others, they can get a result back. The challenge is right now is collecting the specimen, transporting it. We have capacity at our state public health lab, but not capacity to meet all the clinical needs of the state, which is why the chancellors mentioned that they're standing up testing. So we'll have the ability at UAMS to do that testing on site. Now, even when that is available, we're still going to need to increase access to specimen collection, because to do that safely, requires personal protective equipment, requires viral transport media, things that are not in particular short supply, but they're not things that every clinic does all the time. And so we're going to work with providers, encourage them to collect those specimens, send them into the commercial labs so that we can increase our testing capability across the state.
Can you handle scores? Can you handle hundreds? Can you handle thousands? What can you handle?
The limiting factor right now is our healthcare providers' ability or willingness to collect those specimens and to send them in. The commercial labs have large capacity to do testing. It's the issue of getting the patient to the place to collect the specimen and the specimen to the lab.
Department of Health, what's the throughput for the Department?
The Department of Health, we have a relatively limited capacity in our public health lab. We're currently doing about 20 a day. We can probably double that, but that's not going to meet the needs of the entire state. What we are using our public health lab for is to see where the epidemic is going and where it's not. So we are testing known cases, known contacts to known cases at this point.
I would just add to that regardless of the capacity to do testing, probably the more important issue is to test the right people. And the Arkansas Department of Health is providing us with guidance about who should be and possibly even more importantly, who shouldn't be tested. This is not something that individuals need to be randomly screened for.
Dr. Smith, is there anything you have to do differently in this case to protect healthcare?
Before he answers that, I do want to add on the testing. This is something that I conveyed to the Vice President on day one, actually it was about a week ago, in terms of the need for more testing capability in the states. Whenever you look at the commercial providers that are doing testing, it's a slower process. We can do it quicker at the Department of Health. We need to have more capacity there. We need to have UAMS online with the capability of doing testing as well. As there's more concern or the public becomes more aware of this, there's going to be a greater sense of need for testing. I had a call today from somebody just saying they felt like they needed a test, and you go through that circumstance. So yes, I'm a healthcare provider now, but you know, so we do want to enhance that capability. And then to your question,
What needs to be done to protect healthcare workers?
Protecting healthcare workers involves personal protective equipment. It involves the protocols and procedures that all healthcare facilities have in place. The challenge is, of course, when someone first arrives, healthcare providers need to think about this first and protect themselves rather than waiting until sometime later before they have that suspicion. And you know, this is a rapidly evolving situation, but this is a good call out to our healthcare providers to think of this and make sure that you take the steps to protect yourself early on rather than sometime later.
One final question.
None of the patients have been admitted into the hospital, and where are they being treated, and I guess what does that treatment look like?
Remember, the vast majority, at least 80% of those individuals who have COVID-19 will be just mildly symptomatic and will be able to self-isolate at home. The smaller proportion who get sick or get very sick, those are the ones we want to make sure that we have adequate health care facilities for. Of the 5 new ones, none of these individuals are sick enough, at least not at this time, to require hospitalization. So they're isolating at home.
Thank you very much. I hope that's helpful to everybody. Yeah, I know it is. I know it is. Yeah.
Thank you. I brought my cheap nightlock for someone else.
Governor Asa Hutchinson with a press conference addressing the public on COVID-19, announcing now that there are 6 presumptive positive cases here in the state of Arkansas. Of the 6, one of them is in the hospital at Jefferson Regional Medical Center. 4 additional patients had contact with that one patient. They are all now in quarantine at home on an outpatient basis. And then the 6th case was a person who had traveled out of state and was infected after traveling out of the state of Arkansas. The governor saying that schools are now closed in the 4 counties where they've identified these patients. Those 4 counties are Pulaski, Saline, Grant, and Jefferson County. Schools are now closed in those counties through spring break. Employers are taking measures now, the governor said, to be generous with time off for maybe parents who need to be home with their children, or perhaps people who need to be in quarantine if they've been in contact with any of these patients. Dr. Nate Smith, the state health officer, the governor's health secretary, said we want to interrupt transmission of COVID-19 before it occurs here in the state of Arkansas. Also, Dr. Nate Smith telling all of us that we need greater testing capacity. We're working to expand that, and that none of the 6 individuals or the 5 newest diagnosed individuals had been in quarantine before testing positive. So the state health department is working to identify people who may have been in contact with any of these 6 patients who have tested presumptively positive for COVID-19 or the coronavirus. UAMS officials, along with the head of Children's Hospital, were there alongside the governor, saying that they encourage the public with concerns about children to call an 800 number, 800-743-3616, rather than initially coming to an emergency room to potentially infect other people. The UAMS chancellor saying that they have a telemedicine program where you can get online face-to-face with a doctor rather than leaving your home and again going into a doctor's office or an emergency room situation. Again, the last 48 hours, Governor Hutchinson said, have been a, quote, whirlwind, as he was advised overnight, in addition to the initial first case here in Arkansas, that 5 more cases had been diagnosed. With so much developing today, be sure you are keeping up with the facts. We are keeping track of any and all updates regarding coronavirus. You can text the word FACTS, F-A-C-T-S, to 501-376-1111. Stay with THV 11 on air and online, and we will have more details live on our air at 5, 6, 6:30, and 10 o'clock.